Kathy, are you good with me? Go ahead and starting. Kathy, are you good with me starting?
We can get started.
Okay, perfect. Good afternoon, everyone, and welcome to today's webinar. My name is Chelsea Townsend, and I'm the director of the South Carolina Prescription Monitoring Program, and I chair the NASCSA Education Committee. I'll be hosting this afternoon's webinar along with NASCSA's Kathy Keogh. Hopefully you read through the scrolling materials while waiting for the webinar to start, which provides information regarding our sponsors, a NASCSA disclaimer, housekeeping items, and announcements. A couple of things to note: the program agenda for the annual conference has been posted on the website. We encourage you all to take a look. We have so many great sessions planned. Also, make sure that you guys send in your registrations for the conference if you're planning on attending, and book your hotel. Unfortunately, the hotel that we booked for the room block has already sold out, but we will be posting a list of surrounding hotels on our website that should be up within the next day or two. We also have some very exciting things planned for NASCSA's 40th anniversary. So please reach out if you need any more information about it. Today's webinar and all of our webinars throughout the year would not be possible without the generous support of our sponsors. So thank you to our sponsors. And thank you for taking the time out of your day to join us for today's webinar on the Drug Supply Chain Security Act. Are you really ready? We're excited to have Erica Vost and Andrew Funk from NABP with us today, so please allow me to introduce them. Erica Vost leads operations for NABP's Pulse team, which is a platform to support regulators, dispensers, and other trading partners by providing tools and education which enable implementation of DSCSA's 2023-2024 compliance milestones. Erica is a certified pharmacy technician and holds project management professional certification. Prior to her work with NABP's Pulse team, Erica worked on the Healthcare Merchant Accreditation team, which both verifies legitimate pharmacy community members and conducts research on illegal actors. Andrew Funk is the Member Relations Governmental Affairs Director at NABP. Andrew works alongside NABP's member boards of pharmacy to provide regulatory resources and support to assist state boards of pharmacy in carrying out their mission of protecting public health. Andrew also leads NABP's prescription monitoring program, Interconnect program, which facilitates the sharing of PMP data across state lines. Prior to joining NABP, Andrew served as the executive director of the Iowa Board of Pharmacy, which regulates all parties of the drug supply chain, including wholesale distributors and 3PLs. So welcome, Erica and Andrew. The floor is yours.
Well, good afternoon, everyone. Thanks so much for that excellent introduction, Chelsea. Very much appreciate it. I will go ahead and share my screen. So I'm going to provide the group with a little bit of background on the DSCSA, and then we will have Erica jump on, and she is going to get into some of the nuts and bolts of the Pulse platform by NABP, and sort of go through those components of the webinar today. So give me just a second. I'm trying to find. Here we are. Okay, so we have been sort of going through the Drug Supply Chain Security Act, and It originated in 2013 with some infancy steps on securing the nation's drug supply chain. And then it's had a progressive sort of implementation timeline for different criteria for the law to be implemented within the supply chain. One thing that I always like to give groups background and information on is sort of the why. I think anytime regulators, whether those are state regulators or federal regulators, there really needs to be a fundamental reason for why particular regulations are being developed. And so, to answer the question, why NASCSA? Why do we need stringent laws that secure our nation's drug supply chain? Well, bottom line is they're bad actors. Any opportunity that there is to make a significant amount of money, you're going to have bad actors jump in and try to capitalize on that. Most recently, we saw an issue with the drug Biktarvy, and there was a large-scale counterfeit diversion operation in which all of those states you see in yellow received counterfeit shipments of Biktarvy. And Gilead, the manufacturer of Biktarvy, suggested that there was over $250 million worth of fake HIV drugs that were distributed across the United States, 36 states and over 600 unique pharmacies. And some of the products were not Biktarvy at all. Some of those were recycled distributions from patients who had received the drug and then sold the drug back on the gray market. And so these types of reports have been, showing up for many years. And personal experience in Iowa, when I was the director there, I received a notice from one of our large distributors that transaction information that had come across their plate that they were not the suppliers of this particular drug. And that was all the notice said. We opened up an investigation, and we had one of these illicit wholesale distributors doing exactly this. This was the scheme that they were involved in, and it was called the patient buyback scheme. So a pharmacy is dispensing a drug to a patient, which may or may not legitimately need the product. The patient then sells that drug at a significant discount to a counterfeiter. The counterfeiter will remove the patient labeling, clean the bottle, make it look as though it is a product coming directly from the manufacturer. Those counterfeiters will then sell the product back to a unscrupulous wholesale distributor. And then that distributor generally would sell it to sort of a secondary distributor or another distributor that may be a little more reputable. And so any pharmacy or pharmacist that might be on the call, you may recall, and I'm not saying every one of these faxes that would come through in your pharmacy that would say, fire sale, 5% off whack, buy now. Those are the kinds of things that some of these distributors would send in order to kind of hook these pharmacies on buying their product at below market value, even though those distributors are making a significant amount of money. So the pharmacy then buys that product that's already been dispensed to the patient and then sells it to a patient, thinking that that product is completely legitimate. So that's the why. These are the milestones. So as I mentioned, this has been going on for nearly a decade. And originally in 2015, some of the foundational components of NASCSA were put into play. And that's when the transaction information and the suspect product handling and reporting became a requirement. So those are the transaction documents that I had referenced in my example that we saw in Iowa, where it was very easy for folks to develop or augment the transaction data and send that along to make it look as though it was a legitimate transaction. But at the at the root of it, it wasn't. So 2019, 2020, you can see there were some additional components that were put into play. Serialization of product, verification of serial numbers for suspect product, which became enforcement delay to 2023. And then finally in 2023, that was the milestone end of incorporating DSCSA fully. So this was where the supply chain was required to be fully interoperable, and that would be the electronic exchange of data and the tracing of that product through an interoperable electronic means. So, facilitating the gathering of history for suspect product or illegitimate product, and then the enhanced verification of authorized trading partners are also part of this interoperability. As you all probably know, there was a enforcement sort of delay. The FDA called it the stabilization period, where this interoperability component was pushed out essentially until November 27th, 2024. So that deadline is fast approaching here. FDA has been clear that there will not be any additional stabilization periods going forward. However, June of this year, FDA did issue exemptions for certain dispensers. So the exemption period extends until November 27, 2026. And this is what FDA is calling the small dispenser exemption. So any corporate entity that owns dispensers and has a total of 25 or fewer full-time employees who are pharmacists and technicians can claim this exemption from DSCSA. Now, next slides and a couple of slides forward, we'll talk about exactly what is this exemption for small dispensers and how does that really come into play here. Pharmacies will need to document the number of FTEs they have within their organization to be sure that they are able to claim that exemption. Again, 25 or fewer FTEs of pharmacists or technicians. Again, I mentioned it already, but I think it's worth repeating. That stabilization period that we've been in for the last year almost is not going to be extended. So are all the small dispensers, are they exempt from all of the requirements under DSCSA? And the answer to that is no. The components that the small dispensers are exempt from really are related to the electronic interoperability. So small dispensers are still required to know their trading partners, to validate those trading partners, to ensure that they are valid trading partners and that they can purchase and sell product to. They have to know where the product tracing information and data is being stored and how to access it. So that data could be, paper documentation. It could be just a file that's being sent by the distributor, but they need to know and probably have policies and procedures identifying, how this process is put in place within their pharmacies. And then they need to know how to identify suspect or illegitimate product and have a process, policies and procedures in place to be able to quarantine that, investigate it, and then communicate those suspect or the investigation back to the distributor or manufacturers within the supply chain that they've purchased from. So again, number 4 there, develop an update and adhere to their policy procedures that are compliant or shows that they're compliant with the components of the DSCSA. So then what are the small dispensers actually exempt from? So mentioned already, it's that electronic transaction, the interoperable components of DSCSA. So exchanging transaction information and transaction statements with trading partners. That can be done as they're currently doing it, whether that's done on paper or through a document exchange, conducting their verifications of suspect and illegitimate product, gathering that information, making the phone calls to do the tracking and the tracing and determination whether or not the product is legitimate, and then gathering information to respond to a regulator if a regulator has questions regarding a suspect product. And ultimately, the dispensers are required to do all of those things, but it just has to be manual or done through existing mechanisms that they have in place. Now, like many of our boards of pharmacy that create regulations, there's generally a waiver, exception or exemption component to requirements of rules that are made. And the same holds true here with FDA as it relates to DSCSA. And we'll go into that here shortly. So the waivers, exemptions, and exceptions requests, this is for any dispenser that that is not going to be able to meet or fully comply with all of the electronic interoperability pieces of the DSCSA by November 27th. And they really, at this point, should have already submitted the WIR request to the FDA for that exemption to the interoperable pieces of this. So again, this would be for the non-small dispensers that are not able to comply with the interoperability, electronic interoperability by November 27 of this year. Interestingly enough, and anecdotally, NABP has heard that there are hospital pharmacies that are getting as little as 15% of their data from upstream trading partners, with some hospital pharmacies only getting between 20 and 30% of that data. So they've got a long way to go here between September and November 27th. And while some pharmacies have systems in place, if they aren't getting the data, they're not compliant and therefore should file that WIR with the FDA. Importantly, FDA is not going to publish who has a WIR. The trading partners are going to be responsible for communicating the status with their fellow trading partners. So if a pharmacy has been granted an exemption, they would be responsible for showing that exemption to their trading partners before they're making a purchase or before they're doing a transaction. And a strict reading of the DSCSA is that if there's a trading partner that has data but not product, or product but not data, the product is suspect and should be quarantined. So again, that's a very strict reading of DSCSA, and it certainly would encourage folks to consult with their in-house attorneys to make those determinations and interpretations of DSCSA. So then what's the problem? The problem is our supply chain is decentralized, and there really needs to be a tool or tools that can assist the supply chain with achieving that interoperability component that's required under DSCSA. Regulators need a tool to be able to communicate with trading partners in the event that they're performing an investigation or they're on an inspection at a pharmacy and there is suspect or illegitimate product concerns. They need to have a way to track that product and trace it through an electronic means. The trading partners need to be able to verify and trace the products that they're either selling, purchasing, or transacting. And so, that currently doesn't exist, or the requirements aren't there. And then trading partners are required to investigate suspect or illegitimate product. Again, those are things that should be identified in the pharmacies or the trading partners' policy procedures to articulate how and when they are looking into those suspect or legitimate product. And there's not a single directory currently that connects the prescription drug supply chain together. But that's where NABP comes into play with Pulse by NABP. So Pulse is kind of a two-pronged solution to the issues that we see within the supply chain. First, it's a digital directory. So this is a directory where a pharmacy, a regulator, a manufacturer, a wholesale distributor would be able to utilize the platform to identify whether or not a trading partner is a valid trading partner. So it enables the secure data exchange, it unlocks engagement and communication, and it maintains sovereignty and control over that data. It's also an integrated platform. So again, additional relationships that have been built and established. Pulse is able to securely facilitate the DSCSA related communications across the DSCSA, or the decentralized supply chain. So product verification, product tracing, authorized trading partner status, and then contact information for all of those trading partners to get in contact with in the event of an investigation. In this slide, this is probably going to be more in line with what Erica will be presenting here next. I just have this slide here. This sort of shows the communication abilities for Pulse within this digital directory, and it shows that you're able to communicate through Pulse with the various trading partners upstream and downstream to perform those pieces of DSCSA that are required when there are suspect products that you're needing to investigate. So those communication channels, again, work from pharmacy to wholesale distributor, from wholesale distributor to pharmacy, from manufacturer to wholesale distributor, and so forth. So what are some next steps for regulators? A couple things here that I think come to the top of mind. First, reminding trading partners of their existing obligations. So what are their existing obligations under DSCSA? Understanding the small dispenser exemption, knowing that the exemption is there, that they have to qualify it based on the number of FTEs. They ought to be documenting that. And regulators, as they are perhaps performing inspections, these are things that could be discussed with those pharmacies, wholesale distributors. NABP is going to be releasing a dispenser educational tool within the next month. I think that will be coming out very soon, and we'll certainly be sharing that with our member boards for further distribution to who they see fit. And then recommend that any trading partner that's not ready, again, we're kind of already after the fact here, but still get that WIR sent in to FDA if there's not going to be an ability to comply with that final component of DSCSA. Pulse training tools, so training on the platform will be coming here before the end date in November, and so we'll be again distributing that to our member boards as well as interested stakeholders. And then I think too, just performing audits as regulators are out looking at pharmacies, kind of looking at, are they currently compliant? Are they ready? Are they going to be ready? What's their mechanism or solution to interoperability to comply with these requirements November 27 and after? I always like to include a slide just with references where you can, access important information related to DSCSA, FDA, and the membership organizations that have a vested interest in DSCSA compliance, as well as NABP's Pulse website as well. So I believe Kathy will make this presentation available, and all of those links will be available to you to use. And with that, I will thank you for your time here and just getting a little background on the DSCSA, where we were, where we're going, and ultimately what we're trying to do here by protecting public health through a secure supply chain. Certainly open for questions. Chelsea, if you'd like to open the floor for that, or if there aren't any questions, we can just kick it right over to Erica to start her presentation.
Yeah, I think we'll kick it over to Erica. And Erica, if you wouldn't mind sharing your screen with whatever you're going to show.
Of course.
And then
Thank-
if people want to just type in any questions in the Q&A or the chat, that would be terrific. I think I saw somebody raising their hand, but I'm not sure if they, oh, all right, somebody did raise their hand. Do you want to ask your question real quick?
My apologies, I meant to hit the chat button.
All right, we won't call out who's talking, so that's fine.
Okay, then with that, it's great to be presenting to all of you today. Again, I'm Erica. I am the Pulse Operations Manager here at NABP, and I'm pretty much going to show you what we built to be a DSCSA tool that Andrew just went over with you guys. So this is Pulse by NABP, the platform. As you can see, when you first come in, there's going to be a search feature. And this is where we're talking about the first step in interoperability is to be able to communicate and find who the right contact is, no matter what trading partner is. So I'm going to just give a quick example here. If we were to look up a giant pharmacy, we can search them. If I can spell pharmacy, right? And we can actually go to this specific profile and see in here that they have their contacts. So there's going to be a general trading partner communications contact. And this is going to show you the right email to contact. Typically, there would be a name here. For right now, for demo purposes, we just have GE, general contact, and a phone number. There's also a Pulse profile access request, which is just for anybody in your organization that you would want to give a user account to. And this search feature, you're able to search by anything that would pertain to the pharmacy or trading partner. So you can look up by their name, their address, license information, DEA number if you were to have that, GLNs, etc. And if we go back to that profile, I can show you guys what it would, some of the other features of Pulse. So within this, we can also have the anticipated VRS integration dates. These are optional to put on a Pulse profile, but this would let other trading partners know, hey, this is when I'm going to be able to do this for VRS routing services. And then also for transaction information and transaction statements exchange dates. We also have all of the licenses. So specifically for this pharmacy, this is their state resident license here in West Virginia. There's only 2 things in Pulse that cost any type of money. Signing up for Pulse itself is completely free. Claiming a profile is completely free. So to check a status of a license to make sure that it's in good standing, we say it's 0.4 Pulse points. That's the equivalent of 40 cents. So I can demo what it would look like now. So you have Pulse points on your profile. We can go ahead and check the license. So it says license check complete. It will show you the results for the next 12 hours. And it will tell you that this license is active, when it was issued, and when it expires. And you're also able to export this information to a CSV file if needed. Some other things on Pulse profiles they're able to see is GLN, so that global location number. I can show you an example of once you've claimed your profile, you'll actually be able to see all of the information on it, including a regulator communication contact. This is private, so this would only be available to you as a profile owner. And then if a regulator were to come in and need to contact whoever is the owner of this profile, they would also be able to see this information. But other trading partners would not be able to see who your regulator contact would be. And then we can go over to business identifiers. So once you're the owner of a profile, you can see all of your other information. So if you were a manufacturer, you'd have your NDC labeler code, FEIN number, NCPDP, and then these GLNs. And there's actually tags you can set on the GLNs to let people know, this is my ship to I want you to use. Or if you wanted it to be you're sold to, you can also put that in there. You can hide certain GLNs. So say a store has multiple GLNs that they didn't even know were enumerated for them. You're able to remove those from your profile, and we can actually be in contact with GS1, who gives out the GLNs, to let them know that these people do not want that GLN used on their profile. Some other important features are checking ATP status, so that active trading partner status is also another feature in Pulse. That one would cost $1.50 per check. And then we have profile trees within Pulse to organize the hierarchy. So you can have up at the top a compliance profile or headquarters, and then nested underneath it, all of the child profiles. So for the larger chains that we have on, like the VA and Walgreens, they can have their headquarters, and then under it, however they would like to break down, whether that's by state or sub-brand. That way anyone can go in and find those profiles and see who they're nested under as their top entity. Some upcoming things within Pulse will be that product trace and verification. For dispensers, this will be a free feature. For manufacturers, distributors, wholesalers, this feature will eventually cost money. So for right now, one of the major things in Pulse is that it's a directory for communication and contact information. And we do have a large number of dispensers that we have let into a closed beta using Pulse. We will be having an open onboarding starting at the end of this month / early October for the rest of the dispensers that would like to sign up and claim their profiles. In order to claim a profile, if you did not already have access to it, you would use the search feature and find your pharmacy. And then at the top, there is a button that would say request user access. If you were to click this, it's going to ask if you have already have an activation code. If not, you will get a big piece of Pulse branded mail that will go to the resident state license address that's listed on the license. And that's pretty much it for everything about Pulse itself as a platform. If anyone has questions or would like to see anything else.
I don't see any questions actually, except for you mentioned that, I apologize, that one of the features that you have right now eventually will cost money. Can you elaborate a little bit more about that?
The two features that are coming soon, which is the product trace and verification. So those will be completely free to dispensers to align with NABP's mission of protecting the public safety and patient health. But to subsidize that, it will cost money for manufacturers and wholesalers to use that feature. And then the only other two things that cost money in Pulse are to check a license, which we get directly from the state boards, and then to check an ATP status, which is that active trading partner status.
Okay, and I do see a question that said, are the fees applicable for boards of pharmacy?
If to check a license, I would think that the boards of pharmacy would already have access to those licenses, but
they didn't elaborate. I don't know, Mark, if you want to type a little bit more about a little more specificity.
Have you all thought about doing any sort of subscription that would allow them to have access to those paid features, like kind of unlimited access to those paid features?
We don't have unlimited. I mean, it would be unlimited in theory that they can add as many Pulse points to their profile as they want. We do have what we call our Pulse interoperable partners, which are the solution providers that integrated with Pulse. So they can do all of those checks simultaneously for you without you having to log in. We do have all of the major solution providers listed on our website that use Pulse or will be using Pulse. Some of the bigger ones I know are LSpedia. We have Optel, Axway, Blue Link. So pretty much any of those big, and Terrace Vision Group. If you use any of those, they can actually do all of these with API calls. So it'd be simultaneously checking without having a human to ever have to log into Pulse to do that.
Okay, Mark, give a little more clarity on the question. So are the fees applicable to boards of pharmacy for any investigation? And then, Chelsea, I don't know if you want to read off the next question, or I can keep doing it, whatever works.
So if there was like a suspect product investigation, there wouldn't be fees associated with using Pulse to contact someone or look at their information. For those upcoming product verification and trace, there would not be a fee for a regulator or a board of pharmacy to conduct an investigation.
Okay,
Or
and then,
aid in the investigation, I should say.
yeah, the next question is, what about state-specific controlled substance licenses that aren't on their websites? Does NABP have access to those? Example is North Carolina.
State specific, we have the DEA numbers. Outside of that, we don't have any other information for those. But we also wouldn't be sharing the DEA license information. That's private just to the owners of the profiles who see them.
Thank you. Darren, did that answer your question?
We can have him follow up with them. Oh, yep, he said yes, thanks. I don't see any other questions.
And then I will mention that starting in the middle of October, we will be having more education for our regulators as well. And they will be able to use the Pulse platform and log in. We do have some education coming about that. And we have been hosting a monthly meeting. We like to call our champions meeting for regulators with upcoming information and try to answer any questions they have if anyone, any regulators would like to join that.
I don't see any other questions. I think we can close it up, Chelsea.
Okay, perfect. So this has been fantastic, guys. So a lot of information in a short time. Thank you for sharing your insight and expertise. And thank you to you guys again for joining us. Thank you to our sponsors for making today's webinar possible. And on behalf of NASCSA, I would like to thank everyone who's joined us for today's webinar. Like Kathy said, we will be posting a recording of this as well as the slide set if anybody needs access to the slide set. And then we wish you guys a wonderful rest of your day. Thank you, everyone.
Thank you.